Hello, everyone. We're starting now, and if there are any technical issues with the sound, please let the technical support know. I'm sure that they will help you. Yeah, sometimes we have some inevitable technical and organizational issues and obstacles. So today, the webinar is completely on me. And the topic we're going to talk about today is the topic that touches everyone on this planet, the issue of immunity and its role in prevention, rehabilitation in viral infections. There are a lot of viruses in the world, and if we're talking in particular about coronavirus infection, the scientists say that there are about 39 different strains of coronavirus and not only the one that we know about. Today we're having kind of an introductory webinar because in May and in June we're having a short course of 4 classes that would be dedicated to the aspects of allergies, respiratory viral infections, and pathogenic states of respiratory system. I've started to dealing with the issue of respiration and breathing about 30 years ago when I first started working in the field of rehabilitation of respiratory organs, and we worked by Buteyko method. And of course, we paid a lot of attention to natural sources, including essential oils. And of course, the issues of breathing and sense of smell touch every person on the planet. As we know, life starts from breathing. The first information that we get from the external world is the sense of smell, the smells. For example, scientists say that infants have quite a low level of vision, but they can find their mother and recognize their mother by smell. And of course, the culture of respiration and aromatherapy also was started a long ago by our ancestors, thousands of years ago, by people who developed Ayurveda, pranayama, yoga. And of course, modern people describe aromatherapy in modern language. For example, we may say that Light and Brian Miller, in their very much developed work on the matters of Ayurveda, say that almost all the disorders in this way or in other are associated with the disorder of pranavata. That is why the breathing exercises and aromatherapy are effective for almost all illnesses. And if we're talking about modern science, of course, we have the description of the role of aromatherapy by modern language. And here we also have the saying of outstanding outstanding scientists. Aromatherapy among non-medicinal methods of correction is the fastest, and please pay attention to this fact, the fastest and the most effective method. It is an ideal way to correct the neuro-psycho-immunological status of a person. Again, pay attention to this wide range, neuro-psycho-immunological status. Modern science views the human body as a single unit. And it considers that nervous system, psycho-emotional state of a person, and immune system is the whole, the single unit. This is the single system which components interact within each other and influence on each other and the whole body. And as we're going to talk about what is immunity, let's see the basic notions about this term and what we can say about it in terms of aromatherapy. Immunity is a function of the immune system. It is a complex, specific reaction of the body to protect the body from external factors. And we can classify immunity by 3 categories. It is humoral immunity. Humoral, we know that humor from Latin means liquid, and this immunity is associated with the presence of particular protective particles in the liquids of the body. And of course, there are some specialized cells that are responsible for cellular immunity. and they are called immunocompetent cells. And we can mark out the cellular humoral immunity, the action of both the interrelation of antibodies and immunocompetent cells. And if we want to do an immunity checkup, we can hold the simplest testing. We can do two tests. First of all, the white blood cell count and T and B lymphocytes count. T and B lymphocytes are, they are the main components of cellular immunity, T and B lymphocytes. And of course, it might be important to check the level of the presence of immunoglobulins, the special antibodies, the special serum proteins that have their functions in the immune system. And here, the immunoglobulins which are important for us. The immunoglobulin A, the main immunoglobulin of the local immune system, which protects the mucous membranes and neutralizes viruses and bacterial toxins. And also the immunoglobulin M, its presence shows the level of inflammation. The high concentration of immunoglobulin M shows the acute inflammation as a rule. And also immunoglobulin G, which neutralizes the toxins. It is described as the main antiviral component. And immunoglobulin E, which is the most important in the assessment of the presence of allergic reactions. And it is important to point out that we have several, as we may say, divisions of the immunity. For example, you might heard about tonsils and appendix as the parts of immune system. And if we're talking in the context of respiratory organs and immune system, beside the local immune protection in the form of tonsils, for example, we also have some special immune system called mucus-associated lymphatic tissue. And here we may point out also the lymphoid tissue of the gut and the bronchus-associated lymphoid tissue. And lymphoid tissue of the respiratory tract is the part of the unified immune system of the mucous membranes. And we say that all the total lymphoid tissue that is present there in the body is considered as the single organ of immunity. And it is important to point out, as we're talking about immunity, that the human gut contains more than 70% of total amount of immune cells. And which is also important, cells of the intestinal or gut immune system actively produce secretory immunoglobulin A, which we have just discussed. And I draw your attention one more time to the fact that lymphoid tissue of respiratory organs and lymphoid tissue of the gut are the parts of the single immune system of the body. And we will discuss it one more time in the end of our webinar. And another important fact, interesting fact, if we're talking about the interrelation of gut and respiratory organs. Lately, the modern scientists who deal with microbiota and carry out studies in the field of microbiota, they pointed out the presence of interrelation between the gut and respiration. We may call it the gut-lung axis. And if we're talking about the traditional Chinese medicine considers lungs and the gut as the pair organs. And if we're talking about lungs as a respiration organ, lungs have many functions. It is not only gaseous metabolism and not only ventilation function, but of course gaseous metabolism and ventilation are the main functions of the lungs, and during pneumonia those functions suffer the most. Lungs is the organ which is very much active if we're talking about metabolism, and also it is noted that lungs is a very active organ when it comes to immunity. And this is only natural because the air that surrounds us is not sterile. And of course, we have a lot of infectious agents and viruses around us. And if the immune system is weak, we get the disorders. We will discuss it in more detail in our course that I told you about. And if we talk about the respiration organs, it is important to note the system of local immunity of the upper respiratory tract. It is the capacity of the local immune system to hold or to capture the infectious agents while they're still on the membrane and expel them out. And here, important role is given to immunoglobulins and interferons. For example, immunoglobulin A is able to prevent the introduction of viruses into the cells and their reproduction or replication. This protection happens mostly in the upper respiratory part, nose, pharynx, trachea, and the immune protection in the lower parts of respiratory tract happens due to the work of immunoglobulin G. Immunoglobulin E also have an important role here. The cells that produce immunoglobulin E are located in the mucous membrane of the respiratory tract, the lower and upper parts, both. You are all well aware what factors can disrupt the work of immune system and the work of our respiration organs. For example, those may be some harmful admixtures in the air that surrounds us, or smoking that we may call the mass epidemic. But I want to draw your attention to one of the factors which is not that often described as a factor which disrupts immunity. It is stress. The consequences of stress may be various, but as many scientific studies showed, after stress, it is also always noted the disruption in the work of the immune system. The stress hormones suppress the activity of immune cells, lymphocytes. For example, if we meet a person who suffers of frequent colds, this is a result of chronic stress. And we also said that immune system worked within the neuropsycho immunomodulating factors, and we also get some immune responses. One of the mechanisms in our body which is responsible for the nature of consequences of stress is vegetative control. Usually, in the presence of stress, there is high activity of sympathetic nervous system, increased levels of catecholamines, which increases the inflammation and decreases the level of pro-inflammatory cytokines. And during the last part of our today's webinar, we're going to talk about some ways of controlling the immune processes, inflammation processes in the body. By the way, we usually consider sportsmen and athletes as the most healthy people in the world. But according to Dr. Lisen, Institute of Sports Medicine, Paderborn, Germany, the constant state of stress, typical for sportsmen, typical for athletes, leads to the emergence of immunological gaps or holes of general and local types of immune system. And the studies show that the prophylaxis of stress is the prophylaxis of immune depression. And taking the common situation, which is common for all the countries, Russia, Europe, USA, the present situation with lockdown is stress. It's not just the change in our habitual routine and lifestyle. Many people get anxiety and start worrying about future, what is happening and what will happen with their work, and so on. And plus, constantly being in a locked apartment means that the person is being in a situation when there is a lack of oxygen and variety of natural smells. And here, aromatherapy may become a great tool which would help to fight stress. And it may also compensate the lack of natural smells that are present in the outside world. And it is also the compensation of stressful state and hypodynamia, or the lack of physical exercise. The breathing exercises would help to compensate it. We may call those breathing exercises as respiratory training. Essential oils of various plants, and we call them aromas or fragrances. For the plants, those aromas are the natural system of protection. But the studies that started, by the way, in France by René Gattifos, allowed starting and developing a new scientific branch, aromology, or we can call it aromatherapy. In the scientific dictionary, aromatherapy is described as a method of treatment based on usage of natural essential oils that are introduced into the body through the respiratory tract, skin, or mucous membranes. Quite a large amount of medicinal oily plants has been studied. It is about 3,000 of plants, more than 500 of organic compounds. And by the way, if we are talking about, for example, one separate essential oil, more than 500 different chemical compounds may be found there, only in one oil. And the very presence of this wide variety of those organic compounds is the basis for many therapeutical and prophylactic properties of the oils. And again, one essential oil may have several therapeutical effects. It is due to its wide variety of organic components in it. And for us, the most important effects are bactericidal effect, bacteriostatic effect, antiviral, antiseptic, anti-inflammatory, and immunostimulating effects. Also, we will pay attention to the fact that aromatherapy helps to optimize the functioning of adaptation mechanisms, which is important for both for prophylaxis and compensation of stress. Also, aromatherapy has an impact on central and vegetative nervous systems, and also important to note that all the essential oils are being hepatoprotectors. They protect the body from the processes associated with aging. And talking about the sad situation with coronavirus and pneumonia, we note pneumonia is on the fourth place by lethality or fatality rate among other disorders. And we are talking not about coronavirus, but among all the disorders. But if we are talking about coronavirus, pneumonia is also the most frequent cause, the most frequent complication which leads to fatal outcome. Important points about aromatherapy. First, the direct effect of essential oil on the body may be observed right in 15 minutes after the session. They do not have a cumulative effect, they do not accumulate. And after one aromatherapy session, the essential oil molecules get completely eliminated from the body after 3 or maximum 12 hours. And talking about the chemical composition of essential oils, here I presented the main group of compounds that are present in the majority of essential oils. But here I pointed out only those effects which deal with immunity, antiviral protection, and aroma respiratory training. And to make it easier for you to see those qualities or effects right away, I made them colored. For example, antiviral qualities or properties are in yellow, immunostimulating in green, and anti-inflammatory. We'll also see them marked. Yeah, for example, first one, aldehydes have anti-inflammatory and antiviral properties. We may find aldehydes in such plants as melissa, eucalyptus, and lemon. The second compound, ketones, they have wound healing properties and facilitate the release of mucus, and they have the unique ability to stimulate the growth of new cells. And where we can find ketones, in what plants? For example, it is the rosemary oil, which is, by the way, being a lung antiseptic, and the sage oil, which is also a lung antiseptic and have the protective effect for lungs. And of course, I name only the commonest or the most available oils, and the examples may be much more of them. The next compound, spirits, they have bactericidal and antiviral action. For example, the plants such as peppermint and tea tree contain spirits. And talking about the tea tree bactericidal properties, I have this unique historical story. I know that during the Vietnamese War, the tea tree, the essential oil of tea tree was the part of medicinal set for the soldiers. Phenols, they have bactericidal and immunostimulating properties. For example, the essential oils of thyme and oregano, terpenes, the stimulators with antiviral properties, and they very fast at penetration to the nasal cavity during inhalation. And the classic example here, the essential oils of orange and bergamot. And the next one, and the name is quite tricky, sesquiterpenes. Complicated to pronounce, but they are very much important components for essential oils. There were found more than 2,000 of sesquiterpenes. And the sesquiterpenes have antiviral, anti-inflammatory, immunostimulating properties. And it is important to note that they are suitable for all the constitution types, Vata, Pitta, Kapha. And the most common and available examples here are Matricaria chamomile or chamomile and Immortelle or straw flower. The compound ethers or esters, they have anti-inflammatory, antifungal properties, and they also have the harmonizing effect on the whole body. For example, the essential oil of lavender and bergamot. It is interesting that the study of lavender started the scientific branch of aromatherapy. Lavender have a very much great effect on the respiration organs, and we will discuss it during our classes in May. Lactones, the next group. Those are very powerful anti-inflammatory compounds. And the classic example here, the essential oil of inula. And the simple ethers. They have antiseptic and expectorant properties. And they also have a harmonizing effect on all doshas. For example, essential oil of anise and basil. This is the minimum amount of information that we have to remember when we make a discussion within aromatherapy and immunity. And aromatherapy and its effect on the body. Essential oil impact on the body happens in two different pathways, through neuroreflex and humoral systems. Neuroreflex means that here we get impact through the nervous system. Olfactory centers are in a close proximity to the limbic system of the brain, which controls all human emotions, vegetative functions of the body. Essential oils also stimulate the synthesis of neurotransmitters, regulate the tone of the nervous system, and of course, every person have their favorite fragrance or favorite smell, which makes the person calm down and makes the person happy. This is the very example of the neuroreflex impact. And a humoral mechanism. During the inhalation, we have the aroma molecules absorbed in the mucosa and then passing the metabolism and going into the blood, influencing the hormonal state. Here we have the limbic system presented. It is associated with brain cortex, the frontal lobe, and very important nervous centers that regulate the overall metabolism and the state of the immune system. The thalamus, hippocampus, the amygdala, hypothalamus, and olfactory bulb. Olfactory bulb is directly associated with the sense of smell. We also will talk about it in more detail in our classes. We will have more time for that. And influence on the level of the body, the influence on mucous membranes of the nose and bronchioles. Then the aroma molecules get into the lymphatic and circulatory systems, which means that they start circulating throughout the whole body, and it means that they are influencing not only the respiratory organs but all the body system. Why we say that essential oils get completely eliminated from the body? Because they have the volatile nature. And of course, they can be expelled through the respiratory organs themselves and partially through the urinary system. Another important effect of essential oils is that they have the antimicrobial power. Of course, as we already noted, that essential oils of the plants is their natural protective power against microbes and external organisms. The mechanism of bactericidal action is associated with the destruction of microbial cell membranes, followed by violation of intracellular metabolism and the destruction of the bacteria. They have this activity against those microbes who have antibiotic resistance. They make antibiotics be more powerful, and the moment which is important that they do not disrupt the composition of the good microbes. And in the scientific society, there are discussions about the nature of this bacteriosis. And of course, we all know that usage of antibiotics disrupts the nature and the state of microbiome. And essential oils do not cause this bacteriosis. And by the way, in one of the scientific reviews of coronavirus which was written in Italy, if I'm not mistaken, it was in the review or the scientific article claimed that Italy is the country where the doctors prescribe antibiotics in a regular basis or very much often. And this fact played a very important role in the decrease in the level of immune system in the population and such a great spreading of the disorder. And in description of antiviral effect of essential oils, it is said that they affect wide range of viruses. Essential oil is able to destroy the lipid layer of vibron or the virus and leads to the splitting of membrane proteins and inactivate the virus. For example, there was a study which showed the powerful effect of such plants as mint, sage, oregano in the treatment of influenza. You remember that we described the components of essential oils, and the antiviral effect of essential oils is present due to the presence of aldehydes, ketones, and different varieties of ethers. And they also help to improve the synthesis of interferon. And interferon is a great power against viruses. It is the universal tool. And different scientific data tell us. So various scientific articles, there is scientific data telling us that the incidence of acute respiratory viral infections when using aromatherapy is reduced by 50 or even 80%. With the usage of aromatherapy, the duration of infection, the duration of the disease is significantly reduced, and the frequency of complications. And we talked about immunoglobulin A. Essential oils improve synthesis of immunoglobulin A. According to different scientific data, essential oils act as mild immunomodulators. And also the general scientific data that essential oils of mint, lavender, and sage possess anti-inflammatory, antiseptic, and general stimulating properties. And if the person is already at the stage of clinical manifestations of the disorder, the studies showed that after the third and fourth sessions of aromatherapy, the patients have improvement of the general tone of the body and nasal breathing. This may be explained by the positive influence of essential oils on the humoral, cellular, and local immunity. And as you remember, we described immunity as humoral, cellular, and local immunity in the beginning of the lecture. The general scheme of the aromatherapy medicines influence, we have neuroreflex pathway, which is carried out through central nervous system, and humoral pathway is realized through the capillary network of respiratory organs and skin. Both pathways are able to improve the total functional condition of organs and systems. In particular, it is respiration, digestion, blood circulation, and metabolism. And the therapeutic effects may be divided into local and systemic. And both the groups include immunomodulating effects. It is the effects which are also important for us in the local immunity and antimicrobial, and also if we have the respiratory tract disorder, anti-inflammatory and bronchospasmolytic effects also become important here. And systemic therapeutic effects also include psycho-emotional influence, vegetocorrective, microcirculatory. Vegetocorrective effect is the effect of correction of functioning of the vegetative nervous system. It is important for prophylaxis of stress or stress violations, and also to control the inflammatory processes in the body, which we will discuss later. What microcirculatory means? It means the improvement of the work of capillaries. And the question that bothers many people, allergy. For example, allergy to fragrances in the patients with bronchial asthma or allergic rhinitis. And it is important to note that there were scientific studies that showed that the molecules, the aroma molecules, may cause allergy only if they have the mass not less than 5,000 daltons. And the other molecules of aroma essential oils have their weight in the range not more than 300 daltons, which means that they cannot cause allergy. Also important, there may be developing the immunodeficiency states in the body, and flu, the viral infection that we all forget about due to coronavirus infection now, but it will come back. In the epidemic, at the epidemic state or during epidemics of flu can damage or can influence of about 30 and 40% of population. And if we talk about aromatherapy as a tool to improve antiviral immunity, scientists note that aromatherapy increases the production of interferon, has an antiviral effect, increases the levels of alveolar macrophages and the number of T lymphocytes. And to correct the local immunity of bronchopulmonary system, we can use the oils of monadra, lavender, and basil. It is marked out that the most important components of those oils are ozulin and camazulin. They have the well-pronounced anti-inflammatory and anti-allergic properties, and also camazulin activates the function of the immune system. And also research has shown that essential oils act as bioregulators at all levels, subcellular, cellular, systemic, and or overall body level. This table might be useful for those who are going to deal with aromatherapy at the professional level. I built this table on the basis of various scientific data held and scientific studies held within the topic of aromatherapy. Here you can see the names of essential oils which are more relevant within this topic.
Звеньев иммунной системы, на которые то или иное масло оказывает или не оказывает влияние.
And here you can see the particular parts or particular chains of immune system and the influence or the absence of influence of this or that essential oil on this particular part of immune system. And here I marked in red the immunomodulatory action. It is immunomodulatory and not immunostimulating effect. It means that this component is able to support, to maintain immune system, but do not cause the dramatic changes in its activity. And in terms of lungs and the health of respiration organs, here the important part of immune system for us is improvement of the surfactant lung activity. And surfactant layer is the thin biomembrane on the surface of the lungs, which is responsible for the work of the immune system. And here we see that such oils as basil, lavender, mint possess this property, and they are quite available.
Ну, также шалфей.
And also sage. And the essential oil of mint have the effect on the vegetative nervous system. It improves its functioning, which is important to protect from stress. And during our classes, we will discuss those essential oils in terms of particular disorders, bronchitis, rhinitis, asthma. Of course, a wide range of available essential oils sometimes may confuse a person and the specialist, because it is important not to only to correctly choose the essential oils for a particular disorder, but also to do it accordingly to the constitution of a particular patient and current state. It is important to take into consideration physiology and constitution of the patient, and to generate the individual recipe for aromatherapy. As for individual recipe for scents or fragrances, we all know that some people who have a lot of money, they are able to order a special personalized, based on personal preferences, aroma composition. And to make it possible to generate a correct individual aromatherapy program and not to be confused with all the wide varieties of essential oils and their properties, the VetaPulse team developed Aroma Encyclopedia module. It has 3 basic sections or tabs: Aroma Rating, Aroma Encyclopedia itself, and Aroma Respiratory Training. Aroma Rating allows us to choose the optimal recipe. Aroma Encyclopedia is a rich informational database. It describes the plants from the point of view of Ayurveda, traditional Chinese medicine, and Western clinical herbology. We may say that this is kind of a unique scientific database on aromatherapy that combined the knowledge of traditional systems and modern medicine. But you remember that we talked, that I said that aromatherapy influences the state of vegetative nervous system. And also I mentioned that respiration techniques also influence the state of vegetative nervous system. And this has becomes only logical and natural that we can combine aromatherapy and respiratory training for objective visualization and for improvement of vegetative nervous system and immune system. But here it is important to show to the patient the correct ways of respiration and breathing. Select a special breathing formula in the structure of breathing action. It is also important that we have an option of objective assessment of the results and an option of showing it to the patient. You can get more detailed information by the links that was shared in the chat. And Aroma Encyclopedia is a program module by VedaPulse, allowing the specialist to form an individual aromatherapy program after a 5-7 minute assessment of the heart rhythm. And the results will be based on the concepts of Dravya Guna, Materia Medica, and clinical Western aromatherapy. It also provides a great opportunity to choose the essential oils and medicinal plants using the nosological filters for particular disorders. And the description tab of Aroma Encyclopedia, which is one of the most important information tools for the specialists. And if in the very beginning we talked about the main common components of essential oils, I only named common essential oil compounds, but in Aroma Encyclopedia, in the description tab, you will get the chemical compound on each and every essential oil according to the latest scientific data. And the next step of Aroma Encyclopedia is a clinical aromatherapy. Here we may find the description of medicinal properties of essential oils and special contraindications for each essential oil. There are not that many contraindications for essential oils, but they are present, so we have to know them. We'll also discuss it during our classes. And aroma rating. And aroma rating describes the oils by upper, middle, and lower tones. It also offers various methods of usage of essential oils, and you can generate automatic conclusion or report, and you can send it via email or print it for a patient. This is a screenshot from a program, the example of description of a plant. Here we see lavender, one of my favorites. Here we can see the medicinal properties, the influence of on psycho-emotional state, the usage in cosmetology, and the compatibility of aromas. Because, you know, we have the fragrances that can strengthen each other or have the controversive effect. Rosemary, this is a very much useful plant when we work with respiratory. It is often called the lung antiseptic. It is good for psycho-emotional status or memory, first of all. And I draw attention to one of the effects, the hypertensive effect. And here the example of one of the contraindications. Rosemary is contraindicated to the people with increased blood pressure. It is allowed in normal blood pressure and in lowered blood pressure. This is the screenshot from the program, the description of a plant. It is much more and wider. I only have the limited amount of space on the slide. With the help of Aroma Encyclopedia, you can answer almost all the questions of your patient because it is not that much of information, the correct information there in the internet and so on. And according to my personal experience, the more the patient understands, the more the patient knows himself about the effects of the essential oils and so on, the better and the stronger the result would be, the result of the treatment. I viewed it several times in my practice in hospital. I witnessed when after the consultation with the doctor, the patient came to the nurse and asked her some additional questions, the information that he didn't get from a doctor. And now it is common that people turn to internet, and you can find there everything, every data. but information in Aroma Encyclopedia is the information based on the scientifically proved data. And Aroma Encyclopedia module can be used by the wide range of specialists, the lifestyle consultants, masseurs, bioenergy specialists, and the persons who are dealing with selling of health products. And of course, the specialist himself or herself needs the compensation or restoration after working with the patients, because working with the patients takes a lot of energy. That is why aromatherapy may become a great compensatory tool for the specialist himself. For example, such stressful medicinal professions and spheres as surgery, for example, the surgeon may have aromatherapy to compensate all the stress that he deals with at work. The people who work in ambulance, we know that people have different shifts, night shifts, day shifts. Such regime distracts the biorhythms. And there was some scientific study about the nurses. The nurses who take night shifts more prone to cancer. And we also know the phenomena called jet lag. The business people who usually travel to different countries and travel a lot, they have the jet lag. It also disrupts the biological rhythms and demands more energy to adaptation. And here aromatherapy may become a most convenient, the fastest and most effective way of prevention and prophylaxis. For example, during the flight from Paris to Melbourne, you can have 2 or 3 sessions of aroma respiratory training while you are in the plane. Thus, you're keeping your business alive and your health. I mentioned that stress influences the state of the immune system. During the stressful situation, there is an activation of sympathetic nervous system, which causes negative consequences to immune system. Sympathetic nervous system is a part of vegetative nervous system, which is responsible for activation. And the parasympathetic nervous system, which is the opposite or pair system, if I say so. It lowers the level of inflammation. And vagus nerve is the main part of parasympathetic nervous system. It has a powerful anti-inflammatory effect, so-called cholinergic control of inflammation. This is the scientific terminology. And within psychotherapy, and I started my work within this field from the psychotherapeutical field, it is mentioned that aroma or respiratory training may become the natural and the most convenient and available way of controlling stress. And our American colleague Hendricks tells us that proper breathing literally washes the tension out of the body and reduces the level of stress. And the experience and the importance of using healthy breathing to relieve stress is described in the recommendations of the National Institute of Health in the USA, the WISE Air. The proper and correct diaphragmal breathing is described there. We have here a quote in English here. Diaphragmatic breathing is considered by many to be the simplest and most effective form of controlled respiration in the reduction of excessive stress. And it was also mentioned that shortening of breath to 6 cycles per minute causes a decrease in the tension of the regulatory system and increasing parasympathetic influences, and we need those parasympathetic influences to decrease the inflammation processes in the body. And as a result, we get an optimization of the sympathetic and parasympathetic balance, the balance of vegetative nervous system, and the feeling of relaxation. It means that we can and we should combine the usage of aromatherapy and respiration techniques. This is like two sides of one coin. And this coin is nothing but our longevity and health. And for that, we need strong immunity and strong nervous system. They say that all the disorders come from nerves. And coming to our technology, it is called aroma respiratory training. It allows choosing an optimal mode of respiratory cycle. To this moment, you already know the essential oils which are most suitable for your patient. And in combination with this module, you can use meditation module. And the features of meditation module for conducting aroma respiratory training, it allows setting up the individual breathing pattern, time for inhalation, paused inhalation and paused exhalation, and determines the depth and frequency of respiratory acts. And which is also important, it allows showing the visualized results on the assessment of total power of, or total amount of energy in the patient, and energy of the level of stress, parasympathetic and sympathetic nervous system, the balance between them, and restoration and mobilization of resources. Usually at the session should be held in the quiet, calm environment. Aromatherapy is the inhalation of aroma oils through the nose. If we are breathing in aroma oils through the mouth, it is aroma inhalation. Aroma inhalation is another type of therapeutic procedure. We will be discussing it on the classes. We perform during the session diaphragmal breathing. It's supposed to be slow and not more than the duration of the session is not more than 15 minutes. And while being at lockdown, you can have up to 3 and 4 sessions. But the break between the sessions should be not less than 3 and 4 hours. Why? Because you remember I mentioned that the essential oil get completely expelled from the body only after 3 and maximum 12 hours. And the second thing, and of course, we get some particular natural physiological reactions of the body to aroma respiratory sessions. And if we have this interval of 3 and 4 hours, those reactions would be in a mild form. If we have sessions every hour, it will cause the break in the balance in the regulation systems. It will lead to the situation which is close to stress. There is such a saying that each substance may become poison or a medicine. It depends only on dosage. And here, this saying or this rule is absolutely reasonable. That is why one session of aroma respiratory training of 10 or 15 minutes, not more than 15 minutes, 3 or 4 hours of break. And for example, if we carry out 4 sessions during the lockdown, the first session would be after we wake up on the empty or peaceful stomach because we need to carry out the diaphragmal breathing. The last session would be before going to bed, about 30 minutes before going to bed, not less than 2 hours after the dinner. And it's up to you if you have such a desire, you can have other 2 sessions during any time of the day. To control the process and efficiency, we can use Veda pulse. We can set the breathing parameters, assess the stress levels and the level of tension. And this is the example from my practice. The influence on the balance of sympathetic and parasympathetic nervous systems or the vegetative nervous system. We said that shortening of breath up to 6 cycles per minute improves the state of vegetative nervous system. Here, the frequency of breathing is 4 acts of breathing per minute. Inhalation 5 seconds, exhalation 10 seconds, and breathing cycle 15 seconds. It was a young man of 40 years of age, but he was in a great stress. And if you look at 2 different pie charts, before and after, before, you can see the pie chart on the left, the ratio between parasympathetic and sympathetic nervous systems. Parasympathetic nervous system here is in green, and sympathetic nervous system, which is responsible for activation, is in red. And we see the huge influence of sympathetic nervous system. And the picture after, only after 7 minutes of proper shortened diaphragmal breathing, and thanks to the patient, he was not a smoker, and he didn't have asthma or anything, and he did those exercises for the first time in his life, only 7 minutes. And on the picture on the right, we see the absolutely different situation. The great or the good state of vegetative nervous system. I prescribed him to have 3 sessions per day, 10 minutes, approximately 10 minutes each session. When I see this example, I remember the old saying, if I'm not mistaken, it's like, give me the pillar to lean on, and I will turn the world upside down. And here our pillar, which we can lean on, is the regulation of breathing. And using this tool, you can turn your vegetative nervous system upside down from the pathological state to the state of balance. And you will be able to keep this balance in a natural way. And here is the simplest example, something I worked at about 6 and 8 years ago. The simplest example. You can use or carry out aroma respiratory training in the afternoon. Or we may say that in the morning we need stimulating aroma oils, and in the evening we need sedative. Then during afternoon we need regulating and balancing aroma oils. The breathing is calm, and the duration of inhalation and exhalation is approximately close to each other. For example, inhalation 5 seconds, exhalation 7 seconds. And here is my favorite example for the day, basil oil. It has tranquilizing and adaptogenic effects. And according to Ayurvedic classics, basil clears the mind, and we need it during the second half of the working day. Another advantage of aromatherapy is that we know that not only during coronavirus, but also during other respiratory problems and rhinitis, during coronavirus or rhinitis, one of the major symptoms is the loss of sense of smell. And one of the advantages of the basil essential oil is its capacity to improve the sense of smell. Of course, if we carry out the inhalation through the nose, we can use peppermint, palmarosa, rosemary, and grapefruit. I mentioned that it is quite important for the immune system that there should not be any inflammatory process in the body. And also, I showed you the scientific fact that 70% of the immune system comes from the gut. One of the authoritative specialists, Patrice Debray, the professor of Sorbonne and the National Academy of Medicine in France, he claimed that studying the gut microbiota is the key to better understanding of many diseases, especially those which are related to the immune system. Studying the interaction between the gut microbiota and the immune system is a real revolution in the system of the views on the immune system. And another important fact, talking about the control of inflammatory processes in the body, starting from the gut, about the coronavirus. The scientists note that one of the major symptoms of coronavirus, aside respiratory manifestations, of course, is the disruption of digestion. And the results of such studies were published in such American journals as the American Journal of Gastroenterology and Clinical Gastroenterology and Hepatology. You see that those are the major scientific journals And it was mentioned in that article that almost 50% of patients with coronavirus suffered, first of all, not from the respiratory symptoms, but from the digestive disorders, diarrhea, anorexia, vomiting, nausea. Such patients stayed in the hospital, in the clinics for a longer time. And also it is mentioned that were cases when people infected with coronavirus had only the symptoms of disrupted digestion and no symptoms of respiratory problems. And this is what we may understand from this physiological interlink between the gut and the lungs. And of course, it is explained by the fact that in traditional Chinese medicine, the lungs and the colon are considered as a pair organs. It is also important to note that for correction of composition of microflora of the gut, there were developed special products. Those are not drugs or medicines. Those are the group of biologically active supplements. It is the group of probiotics. And which is also interesting, this interconnection between the gut and respiratory system may be witnessed during the intake of probiotics. For example, there is a scientific data that the intake of probiotics increases or improves the features of biomembrane of mucus of the respiratory organs. It increases the concentration of immunoglobulin A. And also there was one study held in scientific and research center to research probiotics in Canada. This is the specialized scientific and research center specializing in probiotics. They note that intake of drugs or supplements with good bacteria increases the levels of gamma interferon. Or, for example, the data from the Institute of Physiology and Biochemistry of Nutrition in the German CTQ, they note that after the intake of probiotics, there were witnessed an increase in the level of T cells, and those cells are important to protect us from viruses. It is the cellular immunity that we described in the beginning. And another interesting study on respiratory viral infections that took place in 2011 in University of Massachusetts. They marked the influence of the intake of probiotics during 3 weeks for prophylaxis of respiratory disorders. And pay attention to the fact that the participants of the study were students, meaning the young people. And those students or participants who took the probiotics, the duration of their disorder was 2 days less than for others, and the severity of symptoms for them were 34% less. And the result, or we can make a conclusion that probiotics have improved their quality of life and increased their resistance to external respiratory pathogens. In our practice, here we use our symbiotic, it's called Vedabiotic. It contains a wide range of good bacteria, which contributes to the healthy composition of microflora of small and large intestine. It is an important influencing factor because the presence of chronic inflammation was found in many people. And the main cause for development of chronic inflammation is the disruption in the state of mucous membrane in the gut. It may not manifest as the well-pronounced violation in the functions of the gut. Chronic inflammation may show itself through other ways. For example, from the violation in the functioning of respiration organs. And it may be the pathological state of joints, arthritis, And it was scientifically proved that obesity itself is a result of chronic inflammation. And coming back to such complicated and severe states as pneumonia, coronavirus, and even simple influenza, people with obesity have the disrupted ventilation of the lungs, which increases the risks of development of severe complications due to those disorders. And control over the inflammation processes in our body and some important risks may be found by genetic nature of our body. The minimum set of genes for testing that we provide here in Novosibirsk is presented here in this table. The first two genes that you see here, TNF alpha and TP53, also responsible or may show the presence of risks of oncology. The third gene, BRCA1, it is associated with the risks of development of breast cancer, and it was the part of the Angelina Jolie's story about the breast cancer. That is why the gene got such a name, Angelina Jolie void gene. And inflammatory processes may be taken under genetic control. There may be genetic factors that increase inflammation, or such gene as interleukin-6. And there are genes that inhibit the excessive inflammation, such as interleukin-10. It is a cytokine synthesis inhibitor. It inhibits the growth of level of cytokine factors. Also CD14 gene, monocyte differentiation antigen, a very remarkable gene, CTLA4. It shows the latent risks of gluten intolerance or celiakia. And another two important genes here in the set is MCP1 and HLA-B27. So we can conclude on the discussion of this very important topic. As you may understand, to talk about aromatherapy and not to talk at the same time about respiration techniques is not a right thing to do. So the most rational and reasonable approach is to combine aroma respiratory training in the form of combination of aromatherapy and respiratory techniques. And also taking into consideration all the scientific data, it is absolutely wrong to talk about immunity without any association with the gut microflora. So, basing on the modern science and also the traditional knowledge of Ayurveda, we recommend such a simple recipe. You should have aroma respiratory training every day, 15 minutes 2 times a day, and 1 capsule of Vedabiotic. We are having several seminars. You see the days here, the days of seminars, the 18th, 25th, 17th. And as a continuation of this introductory webinar, we're having a course on aromatherapy and therapeutical breathing, where we're going to discuss aromatherapy and therapeutic breathing in the matters of rehabilitation and prophylaxis of respiratory, viral, and allergic disorders. And we will talk about all this in terms of particular disorders. The schedule is approximate. There may be shifts, but the starting day not sooner than from the middle of May. And for our foreign audience, for our English-speaking users, there would be separate seminar. And now we ran out of our time, and I hope it was useful for you. And even if you now have to be in the situation of lockdown and self-isolation, you have respiratory training. It is legal to go to a drugstore to fetch some essential oils. You won't be arrested for that. And unfortunately, we do not have time to answer all the questions. I recommend you to prepare your personal questions about your personal practice, the usage of aroma respiratory training in your work, and we will go deeply into those questions during our classes in May. And you can send those questions to the email of Get Education. Just mark them as aroma respiratory training questions. We will classify them and answer them. And another important moment that I didn't say, that aroma respiratory inhalations may be carried out in different forms. For example, we can use aroma lamp, or it can be a pocket aroma inhalator, or you can use a respiration mask, or you can even use the medicinal mask to apply the oil on it. But the optimal position of the body is the sitting position in a chair.
Вы не сутулились.
It is important to have the correct posture, not you should not stoop. If you have the weakened belly muscles, if you have the weakened torso muscles, first several sessions you should support your belly with your hands. Diaphragmal breathing is a natural, innate type of breathing. And after 4 or 5 days of trainings, you would be able to carry out the exercises correctly. Thank you for it. See you on my class on aromatherapy training. Please send me your questions. Goodbye.